Look, just looking at a very specific health-related data point. But look at this, watch this. This is an animation that shows the share of the population with flu-like illnesses, meaning people who are registering fevers, in two different counties here in the United States. The blue line shows Santa Clara County in California. The purple line shows Miami-Dade County in Florida. As you can see, Santa Clara County, you see there's the little timeline inserts there. Santa Clara County started taking action against coronavirus early. By February 10th, Santa Clara County had already declared a state of emergency over the virus. By March 5th, the county had issued work from home guidance. By March 9th, there were further restrictions on public gatherings in Santa Clara County. Shortly after that point, you started to see a new downward trend in the share of the population with flu-like illnesses, with fevers. That downward trend became more precipitous after further measures were put in place, after schools were closed and a shelter-in-place, stay-at-home rule was put into effect. That's Santa Clara County. That's the blue line. Look at the purple line now. Look at what happened in Miami-Dade over the same period. In Miami-Dade County in Florida, they didn't take any action until March 12th when they issued their state of emergency. In that county, cases continued to rise. Didn't start to fall until several days later, till after the schools were closed, as well as restaurants and bars. But once they did institute those further measures, the curve started to bend down. Fewer people started to get fevers. Fewer people started to get sick. Two different counties, two very different outcomes, right? Depending on the speed at which they handled the virus, but both showing the same signs that public policy to keep people apart, public policy to keep people at home, has an impact, as long as you actually go ahead and do it. Here's another animation. This shows the share of the population with flu-like illnesses in New York County, which means Manhattan in New York City. It also shows the cumulative effect these social distancing measures can have in slowing down the spread of a virus. It took the city declaring a state of emergency, restricting public gatherings, finally closing schools and restaurants, but ultimately, because of those measures, it looks like a share of the population with new flu-like illnesses is starting to decline, at least according to this very specific data, which measures people's temperatures as they take them in real time. This data is from a company called Kinsa Health. Last week I told you about them here on the show. They make these smart thermometers that link to an app on your phone. You turn it on, you turn on the app, you take your temperature. It uploads your temperature and where you are to the company. The company tracks who has fevers all over the country. And their latest data appears to show that social distancing measures make a difference, that they work when they're implemented, and then the numbers just keep rising if you don't implement them. But their data, which again is very specific, it's literally just them mapping fevers around the country and statistically dropping out from that data what you would expect from a normal cold and flu season. Their data, their fever map of atypical, what you wouldn't expect for this time of year fevers, this heat map that they're able to project for the country, it also ends up putting a bit of a bullseye on places that we should perhaps be more concerned about than public policy would suggest. Take a look at this map that is being regularly updated, again, by Kinsa Health. This tracks, as I said, atypical illness, which means they look at fever, they look at temperature readings, they look at fevers all over the country from people using these thermometers, and they drop out the data that you would expect to see this time of year from a normal cold and flu season. What's the atypical illness that is left after you drop out the normally expected data from this time of year in a normal year? Well, this is atypical illness. This is atypical fever. And as you can see, there's one part of the country that's lit up. And it is not the only place where you see atypical illness. You see that orange around New York, for example. But there's more, and it's more acute in Florida than any other place. For the past several days, people reporting into this one data tracker in Florida have logged a particularly high number of atypical fevers. And yes, that is just one data point. But if I were the state of Florida, this would ring like an alarm bell, especially since their governor isn't even taking the steps that other states are taking yet to try to slow this thing, even with that state's huge elderly population. What should we make of data like this? How should we understand its limitations and what it can help us project in terms of needs and a need for attention. Joining us now is Inder Singh. He is the founder and CEO of Kinsa Health, which is the company behind this data. Mr. Singh, thanks very much for being here on the show tonight. First, let me ask you if I've explained anything wrong or in a wrong-headed way in terms of what your company is doing and what this data seems to show.
Rachel, you got it exactly right. Thank you for explaining it so well.
In these new animations, you line up official restrictions and shutdowns with what appears to be a decrease in fevers reported to you by individuals in specific parts of the country. And I know you're tracking fevers, not tracking coronavirus cases specifically. But what can you tell us about the correlation between these fevers that you're able to document and the epidemic that we're all tracking?
Yeah, so that's right. We're tracking febrile illness. So it could be flu, it could be cold. But I think you explained it well that what we're doing is subtracting out the normally expected cold and flu to get that atypical illness. What we saw in Florida was a massive rise in atypical illness over the course of about a week and a half. A significant slope, way above what you would normally expect, more than 2x in most instances what you would normally expect. And that has me worried, right? Because Florida's got vulnerable populations. The demographics are such that they have a lot of vulnerable populations. They have elderly people. And that time frame between when they started implementing social distancing activities and when you saw the fever start to curve off and diminish, well, that's a significant time for spreading illness. My fear is that in 2 weeks' time, you're going to see massive case numbers in Florida. I can't imagine the difficulty that governors and mayors have in making these decisions that pit someone's livelihood versus saving lives. I can't imagine how they're making decisions with such limited data. This is one tool that gives you some feedback, whether your actions are actually breaking the chain of infection in communities or whether they're not. And what we're clearly seeing with this data is that for locations that have implemented aggressive social distancing, shelter in place, stay at home, they're clearly breaking the chain of infection. They're breaking the chain of infection for cold and flu, and they're breaking the chain of infection for COVID. And what you ultimately want to see is you want to ultimately see those go to zero. You want to see that there is no additional febrile illness in a location, and that's a sign that you've really, almost completely broken the chain of infection.
Let me just ask you, we first talked about your company and this interesting stream of data that you're producing and how it relates to this illness, relates to this epidemic a few days ago. And we started looking at that map that you're posting online and regularly updating, and it was immediately evident that Florida had something going on according to that data. Is there any possibility that there is statistical noise in the data, that there's a disproportionately large or small number of your thermometers in Florida, that there could be something different about the way that state is uploading data that makes it look different, even if nothing all that different is really happening?
We've been mapping illness for 8 years. There's a whole body of literature out there around how we can track and predict flu. It's possible that the actual numbers are not perfect, of course, because we only have a sample of the population. But what we're clearly seeing is community spread of illness. It's very clear. When we launched this site on Thursday, we were nervous. We were very, very nervous, and we shared it with a number of scientists and public health colleagues in advance. We were very nervous to get it out there, but we thought it was the right thing to do. It was the moral imperative to get this data out there because of what we were seeing. Only 5 days before we launched it, we were on a call with 3 very senior public health colleagues, and they said, "Hey, the methods they seem sound. But what you're showing me on this map is, I don't know if it's credible because we're seeing Florida and the Northeast light up. And at that particular time, there were not a lot of cases of coronavirus in those areas. And they cautioned us. Lo and behold, 3 days later, we saw a ton of cases in those areas start to pile up. And so what we did internally, our data scientists ran a couple models to say, let's look at the correlation between hotspots that we're identifying and COVID cases. And the correlation is very, very strong. And the intuition is obvious, right? That when you see spikes and clusters of people that are having fever, clearly there's an outbreak of some sort. The whole point of that map is to say, hey, let's put a flashlight on that particular location, send the test kits in, send the virologists in, find out what's going on. And we need to be doing that in Florida. We need to be doing that in Florida faster.
Inder Singh, founder and CEO of Kinsa Health, publisher of healthweather.us, which is that map that we've been showing in real time here on the screen. Thanks very much for your time this evening. I hope that you'll keep us apprised as things change. It's fascinating as a source of data, and I hope more public officials start looking at it. Thank you, sir.
Thank you.
I will say, just for us as civilians who are not the ones who are making these decisions on public health grounds, seeing not just places to worry about in that heat map, but also seeing those changes over time, seeing the restrictions that we're all living under, that a lot of us are living under, seeing those restrictions get put into place, and seeing that immediately start to bend the curve down in terms of new illnesses in places that are subject to new stay-at-home orders, new school closure orders, new states of emergency, anything else that's keeping people apart from each other and socially distanced, seeing it make a difference in terms of the number of people getting newly infected, to me is motivating. It's not an abstract thing. It's not something that I need to imagine in terms of, the people I can see around me and what I imagine in terms of my own potential role as a vector. Seeing those numbers drop when those policies go into effect is motivating. It at least is for me, and I really hope that it is too for public officials who have authority in cases like this and who have decided thus far that they don't care enough to act.
From your advertising. First word of any.
This is the headline in the Detroit News tonight. Beaumont nears capacity, 635 hospitalized for COVID-19 with limited ventilators. Beaumont is the great state of Michigan's largest healthcare system. And tonight, Beaumont is announcing that already its 8 hospitals are, quote, near capacity for staffing, protective equipment, and ventilators. As a result, Beaumont, that Michigan hospital system, says it has started transferring patients between hospitals to try to find space, and they're beginning to convert some operating rooms into intensive care units. Beaumont says while it currently does have enough ventilators to treat its seriously ill patients, quote, that could change as more people become infected. Again, that's Michigan's largest healthcare system. As of this evening, Michigan has 1,791 confirmed cases. That's 5th most in the country, behind New York, New Jersey, California, and then Washington. Also tonight, we are hearing alarm bells from the great state of Georgia, where they are closing in on their first 1,000 cases. Their first 1,100 cases. The head of a hospital in Albany, Georgia, which is southwest Georgia, says tonight that after 3 of their intensive care units filled up, they improvised a 4th unit for non-COVID patients, a 4th unit with 10 additional beds, but now that one has already hit capacity. And so Phoebe Putney Memorial Hospital in southwest Georgia says they have had to already start discharging patients to make room for sicker ones who are coming in. And that's just a snapshot tonight. Michigan, Georgia, just a couple of the many states where hospitals are already closing in fast on their maximum capacity, where they're already asking for help. But then there's one southern state where the number of new cases, they believe, is rising faster than anywhere else in the world. And it may be traceable to a specific celebration, a specific event late last month. That story's next.
Programs that
2 weeks ago, the great state of Louisiana had 0 confirmed cases of COVID-19. Now, according to a new study by the University of Louisiana, the number of cases in that state has risen faster than anywhere else known in the world. Louisiana has gone from 0 cases to 1,388 cases in 2 weeks. The New Orleans metropolitan area now has more cases than Los Angeles County, which has a population 26 times as large as New Orleans. The governor of Louisiana, John Bel Edwards, is asking for a federal disaster declaration, warning now that per state projections in New Orleans, the current projections of hospitalization significantly exceed capacity beginning on April 4th, which means New Orleans won't be able to continue to provide hospital care at the end of next week. Some Louisiana officials say that Mardi Gras celebrations last month may have been sort of a virological accelerant in Louisiana. $1.4 million people flooded into the city to party and parade through the streets at a time we now know coronavirus was spreading in the United States. Among doctors worried that Mardi Gras in New Orleans this year may Louisiana, when 1.4 million people flooded into the city to party and parade through the streets, it formed sort of a virological accelerant in Louisiana. When 1.4 million people flooded into the city, accelerant in Louisiana. When 1.4 million people flooded into the city to Louisiana, when 1.4 million people flooded into the city to party and parade through the streets at a time we now know coronavirus was spreading in the United States. Among doctors worried that Mardi Gras in New Orleans this year may have been that kind of a problem is Dr. Rebecca Gee. She, until recently, was the head of the state's health department. She's now CEO of LSU Healthcare Services. Dr. Gee joins us now from Louisiana. Doctor, I appreciate you making time tonight. Thank you.
Good to be with you.
What do you make of the governor's stark projection that in New Orleans, at least, hospital capacity may be overtopped by the end of next week?
Yeah, Rachel, as you just mentioned, Mardi Gras was the perfect storm for spread of this virus. We now know that this virus is incredibly infectious. You can get it not just from coughing or sneezing on someone, but breathing or standing next to them. Not only did we have people in floats, but people in parties, people from all over the world came here. And we now know that people who came here and then left from here have now spread the virus to other parts. So we have documentation that the virus was here at that time. And unfortunately, people were throwing beads, sharing drinks, and they weren't only throwing beads, but likely throwing COVID-19, and people were catching that as they came here for the celebration. So because of that, we have the worst problem in terms of the number of cases moving fast at 68% nearly increase in 2 weeks, which is higher than LA and higher than Italy. And so the projections are real projections based on the experience of other places and need to be taken seriously.
How would you assess the hospital capacity in Louisiana? Louisiana is not a wealthy state. You head up one of the flagship university health system in the state. You're former secretary of the Louisiana Health Department. What should we understand around the country if Louisiana does have a rapidly increasing epidemic that's already of considerable size? How much capacity is there in the state to continue to care for people while the number of patients rise?
So right now our hospitals are about 50% capacity, and we estimate that we have about 380 additional ICU beds. Systems like Oxford and LCMC are trying to build capacity, and certainly bed capacity and the availability of ventilators is a problem, but we're also really worried about staff. We only have a certain number of pulmonologists, critical care nurses, and so on in the state of Louisiana, and we don't have enough of those to meet the need that we're going to have when this surges, which will be in approximately 2 weeks, or when the governor said in early April, when we're going to run out of bed capacity. And so that's why the major declaration of disaster is so important that California and New York and Washington have received, so that we can start to get federal assets deployed here. We simply don't have enough here. Now, Louisiana does have a lot of healthcare assets. They're mostly in southern Louisiana, which is bad when you have a hurricane season and you have a storm coming to hit you, but good in this case because they are located near where the people who are getting sick are, which is in the...
This is a storm. This is a storm. It's a different type of storm. But I promise you, this is a storm.
Greater New Orleans area. Of course, elsewhere in Louisiana, people are sick, but the majority here, again, because of Mardi Gras.
In terms of staffing, we reached out to a number of nurses today in Louisiana trying to get our heads around what's happening, what the ground truth is in New Orleans Hospital. We started hearing anecdotally about reports already about there not being enough protective equipment, about nurses not having access to enough masks, about nurses being worried about not being able to protect themselves and potentially bringing this home to their families. Do you feel like the state has a handle on how to get after some of those problems that are already manifesting in emergency rooms and wards around the state?
Well, this is a big problem, and it really is a supply chain issue. And I spoke with Senator Cassidy about this evening. You know, the fact that normally you have supply chain from China that allows hospitals to get what they need, but now is disrupted because you have individuals who are price gouging, buying up hundreds of thousands or 1 million masks in one case last week. Much of which I spent sourcing masks, and that disrupts the ability of normal supply chain. That being said, people are resorting in New Orleans now to making masks in a furniture store, Goodwood Furniture. We're using 3D printers to print face screens. And right now, things are okay, but the estimates are that we're about 4 to 5 days in some systems from being out of personal protective equipment. And today, people are reusing their personal protective equipment, PPE or masks, being instructed to, in some settings, put them in a paper bag at the end of the day and reuse it the next day. And that would never happen in normal conditions.
Dr. Rebecca Gee, CEO of LSU Healthcare Services, until recently Secretary of Louisiana Health Department. Thank you for joining us. Keep us apprised, Doctor. Thank you.
Thank you.
All right, we'll be right back. Stay with us. Reporting on a pilot project that's starting up in one American county that aims to test every single person in that county for coronavirus. This is along the lines of what they've been doing in Iceland already, where they've had fascinating results. One U.S. county is going to try that same kind of project starting tomorrow, a universal testing pilot project that starts tomorrow. We're going to have a report for you on that tomorrow night. I will see you then. Now it's time for The Last Word with Lawrence O'Donnell. Good evening, Lawrence.
Good evening, Rachel. Thank you very much.
Absolutely.
Thank you. Ezra Klein will join us tonight at the end of this hour. He is outraged that Donald Trump is more eager to try to avoid a recession than he is to save lives. Congressman Eric Swalwell will also be joining us to explain how the influence of Nancy Pelosi and the House Democrats has changed the economic aid package being considered by the Senate tonight. And Massachusetts Senator Ed Markey will be voting on that bill. He will give us the latest developments with the Senate legislation. But we begin tonight, as we always must, with the numbers. As of today, the United States has 53,441 reported cases of coronavirus and 690 reported deaths from coronavirus. But there is good news tonight. The President of the United States is not in charge. Now, that would be bad news in a pandemic if the president were anyone other than Donald Trump. So the good news is that the worst, most corrupt president in history is not in charge of what he referred to today as opening up the country. Donald Trump did not close down the country, and so Donald Trump cannot open up the country. If you're at home in America today and you didn't go to work, it's because your employer told you to stay home or your governor ordered you to stay home. Because your governors are in charge of what you can and cannot do in your states now, not the President of the United States, who has not closed a single business in the United States. Donald Trump has not closed anything in the United States, and so Donald Trump cannot reopen anything in the United States. So everything Donald Trump said today about opening up the country is utter nonsense, but it is deadly nonsense.
So I think Easter Sunday, and you'll have packed churches all over our country.
If that happened on Easter Sunday, just 19 days from now, then in May, you would have millions of dead people all over the country. Millions. If you had packed churches all over the country, including California, on Easter Sunday, by May, there could be 1 million dead people in California. Packed churches on Easter Sunday in the state of New York. packed churches in Massachusetts, where the Republican governor today ordered the closure of all non-essential businesses in Massachusetts. And when you're at home tomorrow in Massachusetts, it's because your governor, Charlie Baker, told you to stay home, not Donald Trump. And Donald Trump has absolutely no control over when you go back to work in Massachusetts or in Louisiana, a state that Donald Trump won by 20 points. You didn't go to work today in Louisiana because your governor won't let you. And in Louisiana today, your governor told the president of the United States that Louisiana may run out of hospital capacity by early April. Easter is April 12th. None of the governors who have shut down their states have paid any attention to what Donald Trump thinks about shutting down businesses. None of the fevered daydreams that Donald Trump shared with the country today are going to happen. None of them. Churches are not going to be packed all over the country on Easter. The Pope has canceled public Easter Sunday services at the Vatican, and he did it 2 weeks ago. And Donald Trump wants you in a packed church in America on Easter Sunday. The Pope doesn't want you to die by going to church. But Donald Trump? Well, Donald Trump thinks you're going to die anyway. Donald Trump actually said today that if you do not go back to work by Easter, you will kill yourselves. That's what he said. That's the way Donald Trump actually sees this situation.
Oh my
That's the way Donald
God.
Trump sees you. Donald Trump does not believe that life is worth living if you lose money. If you have less money this year than last year, if you have a lot less money this year than last year, then the obvious choice is to kill yourself, because life is not worth living in Donald Trump's value system.
You're going to lose more people by putting a country into a massive recession or depression. You're going to lose people. You're going to have suicides by the thousands.
Oh
Just
my God.
let that sink in. Suicides by the thousands. You have a president of the United States who believes that if the whole country goes back to work in 3 weeks, the number of people who will die from coronavirus is less than the number of people who would kill themselves if they don't go back to work. He believes that is your value system. He believes that is the state of mental health in America. He believes we are on the verge of mass suicides. And so in order to save you from your looming suicide, he wants you to go back to work and maybe get killed by the coronavirus. But he's absolutely certain that the coronavirus body count will be lower than what he sees as the inevitable suicide body count. In the years of vile madness spewing from the mouth of Donald Trump, we have never heard a sicker, more perverse formulation than what that man said today.
Oh my
He said
God.
it's time for America to choose between death from coronavirus or mass suicide. Donald Trump thinks he's a wartime president, but he doesn't think the war should last for more than another month. Because if it does, Americans will kill themselves. Ask Donald Trump how long World War II lasted, and I guarantee you he has no idea. But he does seem to think that staying home, watching Netflix, is more difficult than winning World War II. Nothing Donald Trump said today has any legal power whatsoever, none. But surely there will be some fanatical Trump followers taking more risks because of what Donald Trump said today, including the deadly risk of gathering on Easter Sunday without enough social distancing. And so it is very likely that more people will get sick because of Donald Trump's Easter vision, and more people will die in America because of Donald Trump's Easter vision. And they won't all be Trump followers, because we are all in this infection pool together. And if Donald Trump encourages people to take risks that get them infected, we are not immune from the infected Trump followers. And so Donald Trump's encouragement of recklessness today is just more encouragement for the sane people of America, the majority, to stay in their homes and not interact with anyone outside of their homes. In other words, it is more encouragement for New York and California and all the other locked down states to remain locked down. California and New York produce almost 25% of the gross national product of the United States of America. 25% of our economy tonight is under the control of the governor of California, Gavin Newsom, and the governor of New York, Andrew Cuomo. And today, New York saw a spike in its reported coronavirus cases. New York's rate of infection is now doubling every 3 days. Today, Governor Cuomo made it very clear there will be no packed churches in the state of New York on Easter Sunday. And he had a very important warning for America.
New York is the canary in the coal mine. New York is going first. We have the highest and the fastest rate of infection. What happens to New York is going to wind up happening to California and Washington State and Illinois. It's just a matter of time. We are just a test case. We are just a test case. And that's how the nation should look at it. Look at us today. Where we are today, you will be in 3 weeks or 4 weeks or 5 weeks or 6 weeks. We are your future.
We are your future. Leading off our discussion tonight, Dr. Patrice Harris, a psychiatrist and president of the American Medical Association. Ron Klain is with us. He's a former senior aide to Vice President Joe Biden and President Obama. He served as the Ebola czar, so-called, during the Obama administration. He is now an advisor to Joe Biden's 2020 presidential campaign. And Democratic Congressman Ami Bera of California. He's an internal medicine physician and the former chief medical officer for Sacramento. Dr. Harris, I want to begin with you because we heard the most extraordinary thing that we could possibly hear in this situation today, which was Donald Trump's assessment of the mental health of the country and his prediction of thousands and thousands of suicide, mass suicide, if people do not go back to work, apparently because he believes they value their paycheck more than their lives. What can you, both as a psychiatrist and a medical professional, what can you say in reaction to the President of the United States saying a thing like that?
Well, Lawrence, in reality, suicide has increased 30% over the last 10 years, particularly among youth and particularly among youth in communities of color. And so we are long overdue in this country for having a national conversation about mental health and suicide. But we are clearly seeing an increase in anxiety and fear and worry right now at this moment as this pandemic spreads. So job one right now is preventing the spread of COVID-19. And we do that by an all-in approach. We do that individually by making sure we are physical distancing. And we also make sure that the health professionals on the front line have the equipment that they need, the tests that we need. Again, all in the service of preventing the spread of this epidemic. That's our job one right now. It is a false choice between the health of this nation and the economy of this nation. The best strategy for economic recovery is preventing the spread of COVID-19 right now.
Congressman Bera, I want to give you, as a physician and a member of Congress, just a wide open field to react to what the president said today.
You know, I think it was ridiculous. We can do this, but right now the right strategy is staying at home, trying to get ahead of this wave that's coming, and you're already seeing it in New York, and I agree with Governor Cuomo. We're going to see it here in California and Washington State, and it will spread across this country. What we have to do right now is stay at home, give our hospitals the chance to build the capacity to try to handle this coming wave, get the protective equipment out to those doctors and nurses, the folks that are putting themselves in harm's way, and thank you for doing that to all those healthcare professionals. But let's stop listening to the president. He hasn't shown leadership thus far. You know, hats off to the governors, but all the states have to work together if we're not going to see that leadership from the federal level.
Ron Klain, the good news, as I said at the beginning, is that Donald Trump is not in control of anything that he actually said today. He can't send anyone back to work. He can't, quote, reopen the country, as he kept saying. There is no presidential power that he has that can make the words he said today come true. But there he was, pretending that it's up to him, when in fact, Gavin Newsom and Andrew Cuomo, between them, have control of 25% of the U.S. economy, and other governors around the country, Massachusetts, Louisiana, Ohio, they're all making the real decisions about what to do next.
Yeah, Lawrence, look, the only decision that President Trump is making about Easter is what his photo op with the Easter bunny is going to look like. He abdicated his responsibility to protect the American people and made no decisions about what should be closed, and therefore he's going to make no decisions about what should be open. And if he's really concerned about the depression, the recession, whatever economic state you want to call what we're headed towards, he should have done his job in the first place. The virus isn't his fault, but the fact that this country wasn't prepared for it, that we didn't test promptly so we could isolate cases, that we didn't get gear and equipment and hospital beds up quickly to prevent the kinds of scenes we're seeing now in New York and other cities in this country, that is Donald Trump's fault.
Exactly.
So the time to prevent
the
economic calamity was 2 months ago. If Donald Trump wants Americans at their jobs, he should have done his job when he had a chance to do it.
Exactly.
Let's listen to what Dr. Fauci said today at the White House briefing when asked about the president's idea of sending people back into packed churches by Easter. Let's listen to this.
Dr. Fauci, since the president said you and Dr. Birx and others will be guiding him in making the decision, where are you now at this time, 19 days from now?
So I mean, that's really very flexible. We just had a conversation with the president in the Oval Office talking about, you could look at a date, but you got to be very flexible and on a literally day by day and week by week basis.
Congressman Barra, that sounds like someone in the Oval Office who's made the decision, I will fight this battle with this president on the day that it matters, and the 19 days from now is when we'll find out exactly where Anthony Fauci is on this.
Look, Tony Fauci is a well-revered healthcare expert. We've got to keep him where he is right now. He's doing what he has to do to stay in position. Let the science and the healthcare professionals dictate how we open up this country, how we start to get people back to work. But right now, we've got to get ahead of this virus, and that is Donald Trump's responsibility. He didn't prepare us for this. We had time to get testing up, to get protective equipment in place, and he squandered that time. So now it's up to the states and the folks on the front line to do what they have to do to get ready. And I trust our governors at this juncture. I don't trust Donald Trump.
Dr. Harris, if you could be in that Oval Office when Anthony Fauci is there talking to the president, what would you add? What would you tell the president?
Well, Lawrence, it's simple. We can either follow the science and the data and save lives, or we can ignore the science and we will lose lives. That is the choice that we have at this moment.
And Rod Klain, you've been in that situation. You've been in the Oval Office. You know Dr. Fauci. How would you translate what we just heard Dr. Fauci say?
Well, as you know, Lawrence, Dr. Fauci served 7 U.S. presidents all the way back to Ronald Reagan. And he's done that by being very, very candid and also very clever about how he delivers that advice. And I'm sure he's delivering a strong message to President Trump behind closed doors. Ultimately, the question is whether or not Donald Trump is going to listen to that advice or ignore it, as he has time and again. Again, we're in this mess not because Donald Trump doesn't have great medical advisors like Tony Fauci. It's because he hasn't listened to them. And so I have complete confidence that Tony Fauci will tell Donald Trump the right thing. I have much less confidence that Trump will listen and obey. But as you say, in the end, it isn't Trump's choice. He abdicated his responsibility. Other people will make that choice for him.
Congressman Barra, Nancy Pelosi came back to town and killed Mitch McConnell's Republican aid bill that they are working on. Do you have confidence that a bill will emerge that the Democrats in the Senate can agree on and that House Democrats can agree on?
I think we'll get something done. Again, they say we're at the 2-yard line. This is a question of values. We want to help the most vulnerable. I understand things are getting hung up because we do think we ought to increase SNAP benefits right now for folks that actually need to put food on their table, that are out of work, that need those benefits. And, the Republicans want more help for the airlines. We're all for protecting the airlines and big industries, but we also want to make sure that this money goes to the workers in those industries, not to stock buybacks or CEO bonuses. Let's get this help to the folks that actually need it, the working Americans, the folks that are being laid off right now.
Congressman Bera, Dr. Harris, Ron Klain, thank you all for starting us off tonight. We really appreciate it. And when we come back, thank you.
That'll be all to my viewers. This is getting old towards watching all this. It's heartbreaking. It's nerve-wracking. It's sickening. It's absolutely asinizing to watch this on a night-to-night level, on a day-to-day level, and it's evolving, and may God have mercy on all of us, and good luck to all of us, and shalom.